Since 2011, telehealth video consulting has been Medicare rebatable in the primary care setting in eligible areas. Rebates and financial incentives are available to GPs to provide face-to-face services to a patient during a video consultation with a specialist. For these telehealth initiatives to be effective, GPs and GP registrars need access to information and training to understand teleconsultation and use it appropriately and effectively in their practices. The ACRIM and RACGP GP training colleges are involved in promoting and educating health workers about telehealth and have a range of telehealth resources on their websites. QRME thinks it is especially important that rural GP registrars and the practices they work in understand telehealth and have produced a telehealth handbook with a detailed summary of information and links to useful resources.
In this video, we'll be using a telehealth dermatology service to demonstrate the process of referring a patient for a dermatology video consultation. We will go on to explain how to set up the room and the process and etiquette of a video consultation.
Skin by Derms is a group of Australian dermatologists who provide dermatology specialist telehealth services to patients and GPs via a secure online platform. The staff at Skin by Derms organise the logistics of the teleconsult and completely coordinate the consultation between patient, GP and dermatologist. It is important that the patient end service has prepared the patient and their consultation room for video consultation. For ease of access and compatibility, the video conferencing software being used is Skype. For the patient end service to participate, they will need 1. A computer with video and audio, 2. Installed Skype software, and 3. A Skype address for the GP attached to an email address. The Skype address should not be identifiable to the doctor's name or surgery. For a GP to organise a video consultation for their patient, they will first need to register on the Skin by Derms website. There are clear instructions for registration. An online referral, including uploading clinical photos, can be done by clicking on New Cases and following the instructions. Skin by Derms staff will coordinate consultations and initiate the video consultation via Skype at the agreed time. After the video consultation is completed, the specialist will post a summary letter onto the secure website and email it to the referring GP.
For the consultation to run smoothly, there's a few things that the GP and patient can do. Try to run on time. Book the video consultation at the start of the GP session and ask the patient to arrive 15 minutes beforehand. It's also important that the patient understands the process involved, has consented and read the information sheet, which can be downloaded from the ACRIM or RACGP websites.
Some thought also needs to be put into the consultation room. You need to ensure there are no lights behind the patient, that the room has plain decor, and you also need to ensure privacy, which can be done by putting a sign on the door. It is also important to test the video and audio prior to the consultation and place the camera so there is a headshot of the patient and GP at an appropriate distance. It will help to have the patient clinical notes open on the computer. Just before the consultation, the patient should turn their mobile phone off. You should also advise the patient where they should look and that there is a delay and only one person can speak at a time. The GP should introduce the patient with their name, date of birth, address, and a brief summary of the reason for their referral.
Good morning, Dr. Smith. My name's Louise Byrne and I'm a GP from Dalby. With me today is Mrs. Ruth Moses. Her date of birth is the 23rd of the 3rd, 1974, and she lives at Grove Parade. Ruth is 37 weeks pregnant and she's got an itchy rash that we were wanting to talk to you about.
The specialist should introduce themselves, including their name and qualifications.
Good morning, Dr. Byrne, Mrs. Moses. My name's Dr. Smith. I'm a dermatologist based over in Brisbane. Mrs. Moses, Dr. Byrne sent me a referral as well as some photographs in regards to your rash itself. So just tell me, I understand this rash has been there for about a week, is that right?
Yeah, that's about right.
The specialist then runs the consultation as they normally would. The GP may be asked for more information during the consultation. The consultation should conclude as it normally would, making sure a management plan has been organised.
Mrs. Moses, we've discussed the likely cause of this rash, which is quite common in pregnancy, and we've also talked about the appropriate investigations and treatment options. What I would suggest is Dr. Byrne will organise all these tests and start you on the treatment. And if there's no improvement or worsening of your condition in 5 days, I would suggest presenting back to Dr. Byrne for another review.
Okay, that sounds fine.
Now, I won't make a routine follow-up for you at this point to see me. However, if the condition gets progresses any further and deteriorates, or if you've got any further concerns on your end or on Dr. Byrne's part, I'll be more than happy to organise another video conference to see you in the near future.
Thanks.
Now, Dr. Byrne, as we discussed, you're happy to organise the scripts on your end for Mrs. Moses?
Yes, that's fine.
That's great. So I'd appreciate it if you could provide her with enough to last her for the duration that I suggested. What we'll do on our end is we'll send off a consultation report to you by email today, and it'll also be accessible on our secure online platform on skinbyderms.com, and you can obtain that at any point. And if you need to see Mrs. Moses again at any point, I'll be happy to see her again.
Okay, that's fine. Thanks for your help today. I'll be in touch if I have any concerns. So, Ruth, are you clear about the management plan at this stage?
Yeah, I'm pretty sure what I need to do. I was just concerned that the rash might affect my baby, so I feel quite reassured that if I follow the treatment plan that things should get better.
I think so. And how did you feel doing the video consultation?
I was a little bit nervous at start, but that improved. The good thing is I didn't have to travel to Brisbane to see a specialist. I've got 2 small children at home to look after, and my baby's due any day, so that was great.
I understand. Okay, so why don't you take a seat in the waiting room and I'll write that prescription for you. But be sure to make an appointment to see me on Monday so we can follow up, or come back sooner if you've got any concerns at all.
Okay, thanks. I'll see you on Monday.
See you later.
The management plan should be clear and include any further tests if required, who will order them and follow them up, and whether there is any further treatment or consultations required.
And finally, it's important to remember that although video consultations can feel awkward at first, they will get better.